every single time we give a yes that we didn't intend to, we are giving a no to something that we care deeply about.
We don't tell people how do you vet experiences so that they actually match what you care about so that you're going to be happy in 5 years instead of building the career that you hate.
That's right. Then you end up being labeled a team player and you're secretly miserable. You're listening to Solving for Joy. I'm your host, Dr. Chrissy Ott, a multi-boarded integrative physician and professional certified life and career coach. This podcast is about joy, what it means, how we find it, and the creative ways people are solving for it in their own lives. I'm so glad you're here. Hello, friends, and welcome to today's episode. It's been a minute, and I'm super glad to be back here with you and excited to introduce you to my friend, Dr. Stacey Ishman. I hear this question so often from physicians: how do I know I'm putting my energy in the right place? And academic medicine can make it feel like you are constantly running on a treadmill, publishing, serving, saying yes, without any clear guidance, internal or external, on what actually matters for promotion, for leadership, and for your own well-being. Hello. So over time, that can be exhausting. That level of uncertainty certainly can be exhausting. And it's one of many reasons, I'm super excited for this conversation with Dr. Stacey Ishman. Stacey is a physician who has spent more than 20 years in academic medicine as an ENT and deeply understands the system from the inside and from a multitude of other angles. She's a full professor, researcher, and nationally recognized leader. And now she helps academic physicians and departments focus on promotable, meaningful work so that their careers can grow without consuming their lives. Welcome, Stacey.
Thank you so much for having me. Although I will give one disclaimer, I was a full professor for 10 years, and I am now doing this full time in terms of helping other folks get there. So I am not currently a full professor, but I do still have my 220 publications, and I'm still finishing my NIH grant.
Thank you for that slight adjustment. You have opted out of full professorship on purpose, and you know exactly what it takes to get there, etc.
Absolutely.
This exhaustion that drives so many to burnout from academic medicine, what can you give us a little glimpse of, especially those of us who have chosen not to practice academic medicine, just to understand it and also to help those in academic medicine clearly recognize themselves? What is it like doing enough but not knowing if it's the right enough, and the unclear expectations of family and duty at work?
Yeah, I mean, I think what's so great about medical training is there's a lot of really easy to see benchmarks. But what happens when you start as a new attending is they just kind of hand you the keys and he'll expect you to know what to do with it. So I was telling a story the other day where I started and I'm in an operating room specialty. And so I walked in and they said, "How do you want to drape this case?" And I said, "I know how 17 other people want to drape this case, and I have no idea how I want to do it." And I just never thought about it. They asked me how to set up a clinical schedule. I didn't know how to do that. I couldn't figure out how to keep track of my projects. I just felt like I walked in the door and someone gave me the keys and they told me there was a benchmark in 3 years, and then I was let loose. So I think we do that to a lot of people, and we think we're giving them the tools, but they don't necessarily know what to do with them. And I think we have a real opportunity to help people work through those things in a very intentional way. And I also think we don't know our values, right? Like, so we don't walk in the door saying, I have to build a career that's in alignment. I
Mm-hmm.
do this exercise with people where I ask their values and how many can they name? It's not a lot when they don't have some prepping ahead of
The
time.
sheet in front of them.
Yes,
I
exactly.
love that. I mean, I think that connecting people with their values is one of the most impactful things that many of us do as coaches in medicine, is to remind them what their drivers are actually in the Department of Values. And that sense of being dropped off into your career as an attending, kind of like naked and afraid.
Yes.
Like, you supposedly have all the know-how you need. Now, good luck.
Yeah. No, and I think that's how a lot of us feel at the beginning. Probably the same is true in private practice, but I felt
It
especially
is.
like that in my academic practice because there was a few extra duties, but I'm sure the person who has to code everything for the first time feels exactly the same way.
I can tell you from my perspective, starting in a private practice, the first year and a half was vertical learning curve for
Oh,
sure.
yeah. I tell people it's 2 years before you even feel vaguely comfortable, and I don't think it matters whether you're in academics or in private practice, but hopefully in your private practice, there's somebody else there who's sort of giving you a hand and is almost feeling assigned to do that.
A little mentorship, maybe? Yeah.
Yeah, I hope. Or even better if it's some sponsorship, if you can get all that wrapped together, it'd be amazing.
Ugh. Yes, that would be amazing. We will definitely want to talk about sponsorship because I think that's probably a big part of how this works in academic medicine. It's not always part of the handbook either. As you get dropped off in your naked and afraid journey of being an attending, whether academic or private, you're also well aware of the cultural message that, by the way, never let them see you sweat. You may
Yep.
not know where you're going, but you're absolutely supposed to look like you know where you're going.
Well, and you made the comment in the intro that you're supposed to say yes to everything. And that
Yes.
is the worst because it is the advice I was given. I'm going to guess you got the same advice since you threw it out there. And we don't tell people how do you vet experiences so that they actually match what you care about so that you're going to be happy in 5 years instead of building the
That's
career that
right.
you hate.
That's right. And then you end up being labeled a team player and you're secretly miserable.
Yeah. And it's the invisible work problem too. If you're a female, especially, and if you're a young attending, regardless of gender, there's all this idea that you're going to be the good citizen. So you're going to I don't know, you're gonna plan the CME course and you're gonna mentor the medical students and you're gonna let every fourth year medical student do their first ear tube, which takes 16 hours instead of 13 seconds. And so, that stuff takes its toll on you.
It really does. Yes. So I'd love to hear a little bit about your story from inside the system. How did you establish this point of view and become aware that you wanted to help other people?
Yeah, I tell people I was in academic medicine for 23 years and I loved 21 of them. And I loved every minute of it, though. Like, I was in academic medicine, I was 50% research, I was 50% clinical. I was really like in love with writing papers and doing data analysis. And then at one point, I wasn't as in love with it. And I loved the teaching. I still love the teaching. And I looked for something else to do. So I was working in some population health stuff. COVID hit, and the best way to get rid of ear tubes and tonsil infections is to wear a mask and never see your friends. So it turns out we have the solution. It's just not very
Oh my
practical unless there's a pandemic. I talked to our population health people and I started working in utilization management. I built the group from the ground up at Cincinnati Children's when they started their ACO. And I got to do something broader and something interesting to me, but at the same time, I realized I wasn't doing the right thing and I needed to do something different. And over time, quite honestly, I built a lovely program. We got accredited, we did things and they changed it and got rid of my position. And
God.
I ended up for the first time saying like, is what do I want to do? And I think everybody expected I would just get another academic job somewhere else. And I
Mhm.
didn't I didn't. I decided, what are the things I love most about it? And I loved the coaching and the mentoring. I had awards for mentoring. I had literally at least 100 students and residents who I'd spent time writing a ridiculous number of abstracts and papers with. And that was the part I really enjoyed. I love when someone comes up to me and says, I did my first ear tube with you, or I did my first tonsillectomy with you. And you get to feel like you've given somebody something that goes on forever as they teach somebody else or do something else in the world. So that's the part I loved about academic medicine. So I said, well, what if and actually I had a smart friend who said, what if you um, just did that? Like, what if your coaching was really about how to help people traverse that journey in a much easier way so that you're the support that they need? Or if they're halfway along the journey and not happy with where they are right now, you can help them find the thing that they love again so that they don't leave just because they have bad guidance.
That's amazing. If your ideal mentee client came to you, like what is a really common first piece of insight? I hesitate to call it advice, but I'm sure there is advising. But what are the early insights that you encourage them to develop?
I will be in full disclosure, there is some consulting and coaching involved
Of
because there is a
course,
journey that I like to help impart. So you're right. True coaching doesn't involve advising, but there is some advising that goes on.
because it's needed.
Yeah, yeah, because I'm trying to get there, help them get there faster. You tell
Mhm.
me your goals, but I might have some tips.
Yeah.
And I have a course called the Academic Kickstarter course that actually starts with finding your values, just like you said, figuring out what you care about, what you want. And then we figure out how to set up your clinical life. We have a module on how to set up your research life and then to know your promotion pathway. So you also made the point you start off and you don't know where you're supposed to go. And it's really true. Like, there's so many people who walk in the door and they either don't remember talking about promotion ever. It might have happened in that first week when you were literally trying to find the bathroom,
Yeah.
or it changed, right? Like, there's different tracks now than there might have been 3 years ago. Maybe you can be a clinician educator now and you couldn't do that before. And so the criteria changed. I was coaching somebody the other day and we looked at his criteria, which he had not looked at in the last 2 years. And there was like, he had to take a CME course in education because that's what he wanted to do. And he would love to do that. He's like, I want to know how to take care of adult learners better. But he had
Mhm.
no idea that that was going to be part of his promotion package. And so those things, they're not a mystery, but we don't spend a lot of time focusing you on them. And so that a lot of the time that you're spending, you're kind of spinning your wheels in the wrong direction. You might be working on that CME course, which
Mhm.
isn't necessarily to get you ahead in the research track and not doing the thing like getting on the podium, which you need to do. And so it is really there's a difference in what it says and how you get there, and the interpretation in between is where we really help translate.
Yeah, there's an analogy coming up for me about when we are in undergrad and we have an undergraduate advisor, somebody who is there to make sure that we get all of the required courses and write electives that
Mhm.
fulfill our degree requirement. In academic medicine, who is that person that might help shepherd you if you're looking to be shepherded?
I mean, you hope it's your division director or your chair. Or if you're in a big department, you hope it's your faculty development person because there should be people in those roles that will help you get there. I think many of us look to mentors, the people in your division in your department who are a few years ahead of you or a lot of years ahead of you, but it
Mhm.
doesn't always happen.
Yeah. And that's where external help becomes crucial.
Yeah, and affinity groups too, right? Like a lot of us have been in the young physician section of whatever our specialty is, or the,
Mhm.
women who like to run on Thursdays or whatever the group happens to be.
Yes, or the Queer Women Physician Coaches Club that Stacey and I both get to be part of.
Well, which we actually didn't realize either the other one was part of until one day
That's
after we'd already
right.
talked for the first time and we were like, "Oh, you're here too?"
That's right. Where's our flag? So, one of the core problems I'm curious about is the mismatch between effort and advancement. Is this something that comes up a lot in your guidance and coaching? Why, being excellent in your chosen field alone doesn't always lead to promotion, or like what metrics get overlooked and which metrics stand out in your division?
Yeah, I think intentionality is more important than effort. Not that effort isn't important, but I've never met a physician who wasn't putting forth effort. So, if you don't spend the time putting it in the right place, and some of that's knowing the right place, having good advisors and good mentors, I
Mhm.
think it ends up frustrating a lot of us. And then I'm sure everybody here has seen the data that women spend more time charting. We actually get 25% more patient messages through the EMR. Our patients literally ask us more questions. It can be something that takes a lot out of you. It doesn't matter whether you're male or female, nobody loves the EMR messages. And so those are the things that take a lot of energy. And I do advise people like try not to make your note perfect. I had a coachee the other day, but I was like, "I want you to just leave one typo." And he literally texted me. He's like, "I left one, but I don't like it, and I'm thinking about going back." And so it's the stuff like that where you try and make everything perfect. It takes 20% more time, but gives you maybe 1% more back that exhausts you at the end of the day. And that's the thing I think we need to learn how to chart quicker, be imperfect, put all the key things down, consider bullet points, the stuff that allows us to get out of work quicker and isn't really going to change our trajectory.
This resonates so much. I'm curious if you find this too. I end up coaching my physician clients so much. First on the perfectionism around charting and like what are you accidentally believing about your notes? And then
Mhm.
two, like the emotional labor that physicians of any kind go into their inbox with because they are simultaneously doing a cognitive switching into, a chart and a patient, a story that's not part of their day otherwise, acclimating inside that cognitive switching to whatever minefield question they might be asking, which is could be, a simple refill request or is this cancer?
Mhm.
You don't know if you're going to be writing back one line or a novel. And you're managing the whole relationship simultaneously while you are accessing your doctor brain and doing all of this at the same time for about 14 messages that came in while you were seeing patients that morning, right?
Yeah, yeah. This, by the way, is why I tell people to batch because otherwise you're going to go crazy. If I'm going to have to do a constant context switching, I like doing it in a row instead of having to do it in between patients because I find that really exhausting.
So, listener, if you have been telling yourself, I just need to work harder or strive for higher levels of excellence, this is for you. This is not necessarily a try harder problem. It is sometimes a focus problem.
Yeah, and it's a when to say no problem sometimes too, right? So you
Ooh,
can
yes.
actually figure out that you don't have to do everything, and that I
Mm,
love I'm sure we all have this. Everybody knows when you say no to something, I'm sorry, you say yes to something, you're also saying a no to something else, but we
mhm,
forget what we're saying no to, and so I think this is another one of those things, like, if I make this note perfect, am I gonna get home in time for dinner? And
that's
which one's
right.
more important to me right now?
Exactly. It's a cognitive distortion of like which thing is closer and easier to focus on instead of what's actually more meaningful in my life.
Yeah.
I had some fun recently creating a guide, The Art of Saying No, a guide for clinicians as just a, gift to clients and people who could use it. And it was so much fun to make and such a reminder that every single time we give a yes that we didn't intend to, we are giving a no to something that we care deeply about, and vice versa.
Those are the worst, because it
Yeah.
hurts your soul to do the thing you just said yes about.
And as a recipient, I've developed a taste for other people's no, even with something that I really want them to say yes to. If they give me a good solid no, it just feels like, oh, that's resonant. That's trustworthy. I feel that in my belly center. I'm like, yeah, okay, good for you. I mean, I'm sorry you're not going to join me for X, Y, or Z, but like, that feels right because you have a clear no.
Yeah, I would say the workshops I do, I ask everybody to really think about one thing they could give up. I don't think anybody has ever said they couldn't think of one thing that they didn't
Mhm.
like or didn't give them joy, that they couldn't figure out how to at least pick something, even if it wasn't easy to give up right now.
I love that. This gives me the idea that I'll be sure to put a little link to that art of saying no in the show notes for today's episode because I think it's just good and sticky for the brain. I want to like normalize what it's like to get support as an academic physician, that it is not a indicator of some kind of personal failing or shortcoming or deficiency or, what's the word for remediation.
Yeah. There's the
It's
R word that comes
really
out all the time.
Yes, it's not remediation to have help. It is actually like the secret sauce.
Well, I think everybody knows the coaching analogy for athletes, right? Like we all think that's normal. I think the problem is in academic medicine, we have used it for remediation. And to be completely honest, my first exposure to a coach was for remediation. And I
Mhm.
wasn't connect with the residents as well I wanted to early in my career. It was something I really cared about. And my chair at the time was so lovely to get me a coach. And at the end of it, his name is Dr. Lloyd Miner. I said, this was amazing. What do I need to do? Like, what bad thing do I need to do next to keep the coach? And he was like, no, no, that is not what we're doing here. So it took me quite a while longer to be smart enough to get my own coach because it just never occurred to me that this is something you did for yourself. And I've started doing department coaching. So we'll coach 15, 20, 25 people across a department. And it's really great because sort of all ships rise. But almost always there's somebody that we identify who could use a little more support or who's like a rock star that if you gave them a little bit more work could really take off. And I've had, the department chairs say, I'm like, do you want to find internal resources? I'm happy to look at your EAP program. And several of them have said, no, there's a negative stigma to getting coaching internally. These are usually either wellness issues or remediation issues. We'd love to use an external
Mhm.
coach. And I understand both sides of that conversation.
When you coach a whole department, are those group sessions where the department is like on a single call, or is it more like parallel? You're coaching multiple people in the department one on one in the same time frame.
Yeah, so we do some workshops for everybody. Yeah, so some skill development. Like everybody gets better at time management. We tell everybody to stop being perfect in their notes. We help them figure out how to prioritize. We do
Mhm.
workshops on how to turn your everyday clinical work into scholarship. But then we also do an individual, usually each faculty member gets two individual strategy sessions and some accountability in between so that they can personalize exactly what they're working on. And it may be I had this lovely guy who was 62 who's done everything. He's been a division chief, he's had an R1, and he was trying to figure out how to spend more time with his family and how to wind down his
Mhm.
legacy. And then I had somebody who literally was 3 months in who couldn't figure out how to set up a clinic schedule in a way that fit for them and that fit their life, and they were feeling frustrated and not sure where to go. And I love seeing the whole spectrum in between. And then there's the mid-career physician who's done it all, said yes to everything, and now is like, "What do I wanna do next?" So it's really, really
Yes.
fun. Yeah, the
How to
no is
undo this
right.
trap
So
that I've gotten stuck in. Yes.
exactly. How do I create this job that I don't like anymore? So it's really
Yeah.
fun to kind of do all that, but that's where I was you and I were talking off camera, but
Mhm,
that people start coaching each other like, "Oh, this is what I talked about. Oh, this is what I talked about." And they are sharing things that
mhm.
their own revelations with each other. So it's this beautiful thing where the culture actually rises on its own because you've got enough people. I guess it's the herd immunity of coaching where you get enough people in a room who have been coached
Mhm.
and learned something that they all get to help even the people who haven't done the session.
Absolutely. This is putting me back in 2021 and 2022 when we got 300 med staff through a 12-week coaching program over the course of about 15 months. And we saw this phenomenon of, people who were in the skills building room having faces that they now recognized in the institution that
Uh-huh.
they didn't know before, and that they have this common language and common experience to draw from. And then
Yep.
realizing that they weren't the only ones suffering from whether it was chart problems or scheduling problems or personality challenges with colleagues or whatever. Like there were all these ways to suffer, and none of them were singular.
Yeah, and that's the nice part. It's not necessarily all group coaching, but having some group workshops, the questions
Hmm.
that come up, everyone's like, "Oh, I have that question," or "I hadn't thought about that." But we are not snowflakes. We are not unicorns, and it's actually a beautiful thing to know there's so many other people out there with the same concerns. Even if I didn't figure it out today, I know I'm not alone.
Which takes it out of the, inner critic's realm of self deprecation and flagellation.
Yeah,
We will not
absolutely.
self flagellate for ourselves to a better way. It just won't happen.
No, and there's so many people whose clinic schedules are really far out, and it's also nice for them to understand you giving up your personal life and your personal well-being isn't gonna fix a system problem where a couple of patients can't get in. Like, I don't get lunch, and instead of seeing 6 months out, now we're 5 months and 30 days out. Like, that is not gonna fix the problem.
Yes.
And if a whole room
Yes.
of people is saying it, you're like, "Oh, okay, we're all trying to do this, and it's still 6 months out."
That's right. So powerful. What is the question that you help people find? Just to answer, like, what is the work I want to do if promotion to full professorship is my goal? Or perhaps they are already a full professor and they're interested in being a division chief.
Oftentimes, it's really figuring out what you want. I think many people decide they want to be a division chief or a chair or whatever the leadership position is because they were told that's what the path is.
Hmm.
It's sort of just like the natural progression. Okay, I'm a full professor, I'm a whatever, and now this is next. And helping people see if that's really what they want or if
Yeah.
now is when they want it
Yeah.
is a really valuable thing because you made that comment earlier about, working your way into a job that isn't exactly what you want it to be in
Hmm.
mid-career. There's a lot of people at that stage who either really do want the next ring, but need to be intentional about how they get there and say no to a lot of that stuff that no longer aligns with the next step, or they absolutely don't want to do it. It was just something they were told they should be doing. And now they have
Hmm.
this guilt and the shame around the fact that they're not fulfilling their obligation or their mentors had all put all this energy into them and they aren't doing it. And
Yeah.
just owning the fact that we get to be whoever we wanna be and do whatever we wanna do is really, really hard, but I think so, so powerful when people finally get there. And getting rid of that guilt and the shame, it is crazy how many highly educated, super smart physicians, male and female, feel guilt and shame about not fulfilling somebody else's dream.
Yeah. It's like the neurotic process kind of drives us up the hill, but once we get to a plateau, the neurotic patterns of our brain are absolutely unhelpful.
Yes. What got you here is not going to get you there, right?
That's right. You arrived, but you're miserable. Solve for that now.
Yes, it's just different problems as you move along, which is the most lovely thing that I've learned in life, is that the problems don't go away, they just change or get bigger or different, and
That's
that's
right.
okay. We are problem solvers, which is how we got here.
A question that Jessie Mahoney asked in one of her recent yoga classes around the first of the year was, what do you want to be known for? And I'm thinking about holding that question as an academic physician might. Sometimes we stumble into what we are known for, but sometimes there's an opportunity to choose. And sometimes both are true. I wonder if that, sparks anything for you, Stacey.
First of all, one of the biggest things that I find it for people is that they might know in their head what they wanna be known for, and they can't figure out why the world doesn't understand it or already know it. And I can give a
Yes.
good example. At the beginning of my career, I wrote a lovely paper on medical student education. I wrote one on an ear problem. I wrote one on a sleep problem. I wrote one on something else. And I said, why don't they ask me to talk about sleep apnea? Well, who the heck knew I wanted to be known for sleep apnea? So some of it is being really intentional and saying, like, this is my word. The word sleep or sleep apnea is going to be in every single thing I do. You walk in here and say you want to collaborate with me on an allergy paper. I'm going to say, can we look at the impact of snoring on allergic rhinitis? How do you put what you care about in all of the work you
Mhm.
do? If somebody says I want to go on a committee, I want to be on the sleep apnea committee, not on the ear committee if that's not what I'm interested in.
Yes. What's your through line?
Yes. Can you tell a story in a narrative so that somebody else knows who you want to be, but also you get to pick who you want to be? And it can change too. I tell people do it for a few years, get promoted. And then if all of a sudden you're an internationally renowned pediatric sleep apnea physician who becomes a coach who just wants to make sure everybody's lives in academic medicine are better, and that's who you get to become. And that might be a little bit personal right there. But I mean, that's the beauty of what we do.
Yes. Okay, I have a completely self-serving clinical question to ask you. We don't always do this, but it's coming up for me. Are you ready?
Yeah, yeah.
Okay. I come from a parent who snored like a freight train. And I remember him having a deviated septum surgery, but it did not resolve his snoring. And as far as I know, until he was quite old, he did not sleep with a CPAP. Surprise, surprise, he died of heart failure related complications. But I don't snore in that way, but I have a feeling that I probably have a deviated septum. And I haven't gone to an ENT about it because I'm afraid that they're going to tell me I need a deviated septum surgery.
Well, first of all, nobody needs a deviated septum surgery. It just can make your life better because it turns out breathing through your
Okay.
nose is a great, awesome thing.
Yeah, I think I breathe through my nose all night long.
You think you do it? Do you breathe well through both sides during the day?
Yes. But if I do like
If you
this,
hold down one side, well, you also have
one side
nasal valve
collapses more.
flaps.
Ooh, fun.
So
All right. I should go meet someone.
I can find an ENT for you, but just to be clear. But I will say like about 30% of adult snoring is from your nose. So it's very reasonable to take care of that. My wife actually got her deviated septum fixed. She snores a lot less. And it turns out she gets so much air through her nose during the day that she was like, is this what everybody gets? It
She's like, I
is,
have
by the way.
superpowers now.
I know. Well, she was already a super smeller, so I'm not sure it helped her because she's like, now I smell things I don't want to smell. But that's what happens in a
Oh
house with
my
five boys
God.
between 14 and 20.
So many smells.
Yeah.
Holy cow, Stacey. Thank you for the free consult on this call. May it also serve somebody else in the world who wonders. My stop bang score is probably 0. I mean, other than snoring. So, really energetic
I
person.
mean, it's good to know. I wasn't going to go that down that, but I'm glad you're paying attention.
Dorks. I love it so much. What permission do academic physicians need? What do they need inside to give themselves permission to do to actually like find their way towards a more joyful career in academic medicine? Because that, as you know, is my through line meaning, alignment, delight, joy.
So I'm going to say two things. One is that thing we keep telling ourselves that joy is going to come later. This is a
Yeah.
phase.
Yeah.
It's not a phase. It's your life. It's your new normal if you don't do something different. And that you need to give yourself permission to actually align your schedule with the things that you care about, because that is the thief of joy for almost every single person that I'm working with in coaching, is that dissonance between who you want to be and who you are right now makes it so you don't love what you do anymore. And life is way too short to have worked this hard to get to something you don't enjoy.
Amen, sister. Do not defer joy.
Absolutely.
Defer loan payments. Do not defer joy.
Especially if you got that low interest rate. Definitely defer.
Yeah. And maybe defer tax payments, friends. Tax strike hashtag. Okay.
Well, this podcast has covered everything.
This podcast says everything and more. And what you guys might not know is that we started off dancing to Whitney Houston. No, it's not right, but it's okay. And I wish that for you today because it was healing. You need a healing, see Whitney Houston. So I have some takeaways. You can't assume people know what you want to be known for. If you don't name your lane, the system will assign you one. Check.
Absolutely. Check.
Make your thing visible on purpose. Put that keyword or topic in everything you do, talks, papers, committees, collaborations, and copy on your LinkedIn.
Absolutely.
Check.
Yeah. Yes.
Right. Um, And what about LinkedIn? I mean, what about networking for academic physicians? That must be so important to do cross institutional collabs.
It is, but I'm gonna tell you, I don't think most young physicians are on LinkedIn. So
Yeah.
I have found way more folks in sort of the more early to mid-career who are on Instagram and Facebook, but I do think reaching out regardless of which of those you're gonna
Yeah.
do or just going to conferences. I'm gonna tell you in person, go to the networking events. I tell all the folks I work with, you might find them cringy, you might be an introvert, I'm an introvert, but go and meet
Yes.
one person in that room, and those are the most valuable relationships that can last for years and turn into all kinds of great things.
I echo that 5,000 times. I am an ambivert. I really enjoy working a room, but I also really need some downtime to recover from it. But
Mhm.
meeting people in your specialty conference, like for me, it used to be, or it still is, the American or International Conference on Physician Health. So many important relationships from those. Number three, learn to redirect opportunities toward your lane. So, could we look at X through the lens of my focus? That is a career shaping move. That's so skillful. Committee choices matter. You get to choose and change your identity over time. So, build the reputation, get promoted, evolve.
All check.
Your narrative is part of your promotion story. It's not just output, it's coherence. It's like a narrative or story they can repeat about you. So make it about storytelling.
Absolutely, yeah.
A quick little side note, I got obesity medicine certified last year. And anybody who's read, things that I've written about or many places I've shared about knows that it's part of a family narrative now. And it inspired me to grow a new branch of my tree of service in medicine because I just was so moved and motivated to be part of the response to obesity treatment in children and young adults.
Oh, that's fantastic. We definitely need that and the overlap with sleep apnea and so many other diseases. But we also really need to think about taking care of those things in childhood because they do turn into chronic diseases in adults, and we have an opportunity if we take care of it earlier.
They do. In fact, there's some data, and I need to search the actual reference for this, but some data about when we intervene successfully in obesity for kids pre-puberty or peri-puberty, the
Mhm.
likelihood of them going on to develop the chronic disease of adiposity and yo-yo dieting and all of the downstream consequences shifts dramatically, substantially. It's really like life-changing intervention. Also, your values in your lane should drive your yeses and nos. So learning the right kind of yes and the right kind of no. I imagine this is really operative in academic medicine, but when an opportunity comes that you can't make fit your lane, it's really good to suggest a colleague who is developing their lane.
Yeah, that opportunity for sponsorship is great in 2 ways. 1, you get to help somebody you wanna help, and number 2, it gets rid of all of the guilt of saying no because most of us are happy to sponsor or help somebody else.
It just feels good unless you're in
Yeah,
a toxic competitive environment, which I hope
but
you're not.
hopefully it is good and not doesn't just feel good, but like you actually are doing something because it turns out for everything out there that you don't enjoy, somebody else loves that stuff.
Yes, it feels so good to pass on an opportunity to the right person. It's the opposite of pulling up the ladder behind you. Yes. What else, Stacey? Is there more to say here for academic physician friends who find themselves in the maze and going like, "Wait a second, which way was I supposed to be headed?" What else do
I
we
think
what their hearts might need to hear today?
I think they just need to know that they're not alone. So if the only thing you can pull together today is to just talk to a colleague or a friend and say, "I'm not loving this," or "Something's hard," or "I can't get where I wanna go," please talk to somebody. It's nice for you and I to say we wanna talk to coaches. I'm sure we both have coaches. I have lots of
Absolutely.
coaches because I find it really valuable. But if you think that's not accessible, talk to somebody. Even if it's your employee assistance program, coaching is not remediation. Coaching is a
Yeah.
way to actually reflect back what you need and help you get there. And so I hope
Yes.
people just realize they should reach out, whether it's feeling like things are great or not. But usually these conversations are happening because things could be better and we can help you get there or whoever you reach out to, whether, I got to tell you, my kids sometimes give me great advice, or I think I told you this earlier, or look at my Instagram reels and tell me it makes them jump scare. So even the jump scare is funny because they will pull up a reel and like jump on purpose just to show me in
Just
dramatic
to mess with
representation
you.
what it's like to get completely horrified by your mother. But you know what? They're interacting with me. So those moments too, where you look at your real life and you have a funny moment or just give yourself the time to actually enjoy the people and the friends and family around you because it does bring it all back together. And hopefully you can remember why you went into medicine to begin with, because I think that's also very grounding.
It is so grounding. It gives me so much joy to know that you are out there doing this work, especially for academics, because it is a niche in medicine that needs niche skill and it needs somebody who has walked that path, which is certainly you. So thank you for doing that. And thank you for having this conversation with me where we can amplify it. Where would you invite people to find you?
So, first of all, thank you so much for having a podcast about joy because I think that is the most awesome thing. And I got to listen to a ton of your episodes and feel better every single time.
Oh, thank you.
But if you want to find me, I am at medicalmentorcoaching.com, or you can get a jump scare on Instagram, Facebook, or LinkedIn.
That is hilarious. I get a jump scare sometimes from my own reels. Like, "Ah." Anyway, hugs to you, Dr. Stacey Ishman. Thank you so much for being with us. Listeners, thank you for tuning in today. And if this lands in a way that you know would be helpful to a friend, especially a friend in academic medicine, please do not hesitate. Forward the episode. It's how we get the word out. We love being here with you and for you. And I hope that your day includes a bright spot of joy.